States and localities across the country are ramping up restrictions as COVID-19 continues to spread at a dizzying pace. Here are the details. From California to Philadelphia and in many places in between, officials are limiting indoor activities like dining and going to the gym. And health experts are begging people to take precautions as Thanksgiving approaches. The U.S. has seen more than 100,000 new COVID-19 cases every day for the past 2 weeks. So Ian Lee is following all of these developments for us. Ian, we're also hearing that hospitalizations are climbing rapidly.
Yeah, that's right. We're seeing a record number of people who are being admitted into hospitals, 73,000 Americans. And, that number is continuing to climb. It seems like every day we're breaking new numbers. And, I was speaking to my family back home and they said there's only one hospital bed available to someone who, if they catch COVID. So it really shows the strain that communities are facing right now as we are seeing this record number of COVID cases.
Health workers around the country feel overwhelmed.
We're working our butts off here. We're trying to do our part. We would love for everyone to do their part because we're exhausted.
We never expected this many people, this many patients, this sick.
There's been 1 million new coronavirus infections in just the past week, and 73,000 Americans are in hospitals.
Cases today will end up in our hospital beds in 2 to 3 weeks.
At least 27 states have imposed new restrictions.
It's not a normal school year. It's not a normal Thanksgiving. It wasn't a normal Halloween. It won't be a normal Hanukkah or Christmas. And 2020 won't be normal, period.
Those restrictions have led to historic unemployment. Ruth Crawford was one of hundreds getting a Thanksgiving package at a New York City food bank yesterday.
You don't think you're going to lose your job? Things happen.
An ICU nurse in Minnesota had this plea for people planning for the holidays.
Stay home this Thanksgiving so that you don't have to ring in the new year with me.
Even lawmakers who previously rejected public safety measures are now implementing changes, like a mask mandate from Iowa Governor Kim Reynolds.
If Iowans don't buy into this, we lose.
And while the success of recent vaccine trials is encouraging, study participants say restrictions are still needed.
I don't treat this like I'm invulnerable and I'm going to go out and risk it. It's just not worth it.
Health officials say it'll be months before vaccines are widely available.
So, you mentioned the recent announcement about a possible vaccine, and a lot of people were celebrating, but, it's several weeks before, or months before anyone will really have access to this vaccine. All of this data and information is coming from the pharmaceutical companies that are developing the vaccines. Experts are urging caution.
Anne-Marie,
what are we hearing from officials?
Good news and some bad news there for you. The good news is that a lot of these pharmaceutical companies jumped the gun. They were preparing for these vaccines before they knew that they were even going to be effective. So when we found out that Pfizer was over 90% effective, and then you have Moderna, which is over 94.5% effective, that was great news for people like Anthony Fauci, who said he was just hoping for at least 75% effective. So you have these two vaccines. They were independently looked at and verified by the National Institutes of Health. Now, what is the question? When can we get those? Well, health officials say that at least 20 million Americans will be able to get it probably by the end of the year. That's still not enough for the country. They say it could still take months before this vaccine is rolled out to the wider public. Anne-Marie?
Yeah, it's one thing to have a vaccine. It's another thing to be able to distribute it. A little later on, we're going to actually talk about some of the challenges when it comes to distributing at least one vaccine. Ian Lee, thank you so much.